There is pushback against the state healthcare worker vaccine mandate that takes effect today.
People who work in hospitals and nursing homes are required to get at least one shot of the COVID vaccine or lose their jobs. CBS 2 political reporter Marcia Kramer joins us now with the very latest on this. Marcia.
Well, Mary and Chris, there's an emotional rally on Long Island today to demand that Governor Hochul rescind her vaccine mandate, under which some healthcare workers have already lost their jobs for refusing to get the shot. But the governor is sticking by her guns.
Governor Hochul, fix this now! Fix this now! Fix this now!
Carrying signs that said "End medical tyranny" and "Nurses for medical freedom," healthcare professionals and politicians rallied on Long Island to demand Governor Hochul end her vaccine mandate that requires healthcare workers to get at least one shot of COVID vaccine by today or lose their jobs.
No one asked us why. As healthcare workers, we do not want this vaccine. I believe myself to be more afraid of this vaccine than I am of COVID.
But Governor Hochul insists the vaccine mandate is critical.
Today is a significant deadline. It reflects my priority to just stop this virus dead in its tracks. We are over it. We are done. We want to move on. And the only way we can do that is to ensure that everyone is vaccinated, but particularly individuals who are taking care of the people who are sick.
Hochul says it's all about giving people confidence in the healthcare system.
Can't we just say that that is a basic right that everyone has to know that they'll be safe when they enter a healthcare facility, or you have your elderly parents or grandparents in a nursing home, that they will not get sick because of someone who's charged with their care?
State officials are bracing for the possibility of staffing shortages at hospitals and nursing homes. Governor Hochul releasing a plan in case large numbers of healthcare workers don't meet the deadline. It involves declaring a state of emergency to allow members of the National Guard and healthcare professionals from other states and other countries to work here. It's unclear what the need will be. As of last week, 84% of hospital employees statewide were fully vaccinated, as were 81% of staff at adult care facilities and 77% of nursing home staff. 88% of employees at New York City's public hospitals have received the shot. Employees at city hospitals will reportedly be put on unpaid leave and can return to work when they get the shot. Some hospital workers have already lost their jobs.
I've been taken off the schedule since Thursday because I said I was not taking the vaccine. It makes me want to cry. I gave 16 years, worked through the pandemic, came every day faithfully. We had to be there. We had to be there. And now this is what they're going to do to us.
Well, the governor said she would sign an emergency order today to bring in the National Guard and other healthcare workers if needed if staff shortages do occur. But she said she'd rather have healthcare workers employ common sense and do the right thing. Chris and Mary.
Okay, Marcia, thank you.